So, as we know, there is a whole lot array of various etiologies which can cause pediatric deformities. So, the open physis, the growth remaining, the different bone healing properties due to different conditions and different age groups, and the technical aspects. So, all these make pediatric deformities different than the adult deformities. So, here, just to show an example, a child with Klippel-Trenaunay syndrome with lengthening of one leg with genu valgus and probably hip which is going to sublux. So this makes it different than the routine genu valgus. Always there is a dilemma between acute versus gradual correction when dealing with a deformity in a child. And there are several factors like age, the amount of desired correction, where is the deformity, the soft tissue status, quality of the bones like OI, it may not withstand external fixator, then associated limb length discrepancy should be taken into consideration. The deformities correction is planned as described previously by speakers. Uh, Sometimes, even though the deformity looks complex, it can be tackled with simple internal fixation device like this malunited femur with valgus procurvatum deformity, which was treated with another plating, a pre-bent plate, and it did the trick. It went on to heal well. So coming to the topic of this talk, the six-axis correction systems, they are useful when there is simultaneous correction of the coronal sagittal plane deformities along with rotational component, and also when it is associated with shortening. Uh, as we have seen in previous talks, all these deformities can be treated with Ilizarov apparatus, but that requires the precise placement of hinge, and that can be challenging, and especially the rotational component. So that has been taken care by this six-axis correction system, and the virtual hinge with these systems makes it little easier than the uh, traditional Ilizarov system. So it works on the principle of six axes which are correcting two rings, and these two platforms can move in any direction, and this principle has been used in industry for various applications. So basically, any complex deformity which needs shortening, lengthening with correction in three axes can be treated with this. There needs to be a program for this deformity correction, and it, it, it is based on the principle that there is something called origin, which is the point on the reference fragment, and there is something called corresponding point, which is the moving fragment. So we want to align these 2 points together, and when we are creating that program, we are telling the software that how these points are placed and how the ring is placed in a relationship to the origin, which is on the reference fragment. So one has to define deformity, one has to define the frame and struts, one has to tell how the frame has been put on the bone. So essentially that means even though the frame is not orthogonal, and if we tell this to the software, that can be taken into consideration and that will not affect the final correction. And also, yes, we have to define the structures at risk. So that is the page for spatial frame, but there are various other programs available with other systems. And then that gives a program like this where one need to change the turn the struts. We'll come straight to some examples. So a 12-year-old boy with Genu-Varus Blount's disease, he was treated with this ortho-SUV type of six-axis correction system. And we saw in Dr. Cherry's lecture that Ilizarov is an excellent, wonderful tool, but the precise placement of hinge is very important. So that can be tackled easily with these systems, and he was treated of his rotation as well as varus and little bit of shortening which was there. Another example of Brown disease in a 6-year-old, again, he was treated with Taylor's facial frame and his varus internal rotation and bit of shortening, they were corrected. Another example, a 16-year-old girl who had genu valgus. She was treated with osteotomy and she went into varus shortening and internal rotation. So this is a good case for 6-axis correction system that was treated with supracondylar distal femoral osteotomy. She was lengthened, it was valgusized, and also externally rotated, giving good result. Another example, a 8-year-old girl who had sepsis in her knee during neonatal period. So that resulted into valgus of the distal femur, almost closure of the proximal tibial growth plate with varus at proximal tibia, varus at diaphyseal femur, and overgrowing proximal fibula. So in a child, considering this, deformity analysis was done. So she needs deformity correction with lengthening in stage 1, and in stage 2 she will need just plain lengthening. For her distal femur valgus, 8 plate was put in addition to the 6-axis correction system to correct that valgus, and the varus deformity was corrected at a resolution cura and lengthening was achieved. At the same time, physiodesis of the proximal fibula was also achieved. We are keeping her under close follow-up as she is going to need another lengthening at later stage. A 15-year-old boy with multiple hereditary exostosis. So he had valgus in his left leg. It was also short by about 4 centimeters. The valgus was coming from distal tibia and subtalar. He had osteotomy in the past and he was short in both femur as well as tibia. So he was treated with a 6-axis correction system. During this correction, he went into varus, as you can see, but it was possible to correct that varus and bring him out to the correct amount of valgus. And after frame removal, his leg lengths are equal and his axis is corrected. Another indication for these systems could be correction of joint contractures. So a 5-year-old boy with sacral agenesis, his knee flexion contractures were treated with a combination of soft tissue releases and a Taylor's facial frame, and he's awaiting to have the other side done. Another example, a 7-year-old girl, she also has deformity in her tibia, but doesn't want anything to be done for that leg right now. She has had multiple surgeries. She also has common peroneal nerve and a very severe equinus deformity of her right leg. So that was treated with a 6-axis correction system. It was possible to distract her ankle joint by few millimeters so as to avoid impingement of the talus against distal tibia. And then the deformity was corrected without doing any soft tissue release. And those are her x-rays before and at end of the procedure. So in short, these systems, the newer systems, they have several indications in pediatric populations. So a lot more options are available, especially in children. The treatment should be chosen based on patient and surgeon factors. And whatever device we use, the treatment principles, they basically remain the same. Thank you.